The idea for the National Embryo Donation Center came about in the late 1990s. It was the brainchild of Christian Medical and Dental Association's CEO, Dr. David Stevens.
It was back in the early 2000s, and that was when the big embryonic stem cell debates were going on, and I was debating people on the media all the time about this. And a thought came to me, no, there is another option, and that's embryo adoption, but there wasn't much of it being done in the United States. So one day at the office, I turned to my assistant and said, find me somebody on our database who's got a background in reproductive technology. And lo and behold, Dr. Keenan's name came up, and here he was just down the road in Knoxville. And we had a number of conversations, prayer together, and God began moving in his heart, and the NEDC was born.
Yeah, I remember that first phone call that Dave made, and I was a good bit younger and pretty naive at that time. I didn't think it would be any big deal. Now I know, before you jump off that cliff, look over the edge and see how far the drop is. It was a phone call that changed my life, and not only my life, but more importantly, the lives of so many donated embryo recipients and the donors themselves. And even more than changing lives, this has brought life into the world, a fully born, fully developed human life into the world. And yeah, there's no bigger blessing than that.
Discussions continued, and under the direction of President and CEO Dale Collins, Baptist Health System of Tennessee agreed to provide space and equipment for the NEDC. In 2003, the NEDC opened its doors at Baptist Hospital for Women. Carol Sommerfeld was hired as lab director and embryologist.
When I saw that they were starting this program here in Knoxville, I felt like I was called. Came in on the ground floor and helped build the lab from the beginning up in this program.
In March 2005, the first babies were born from the NEDC's embryo adoption program. Twins Katie and Sam Lewis are now teenagers.
We're so thankful for the experience that we had, and I can't even put into words how thankful we are to be able to have that blessing. And there's no other way we would have had that.
I think it's kind of cool, like, it's like time travel, kind of, like, I was frozen, and now I'm, like, in the future, and I don't know, it's just kind of cool.
In 2009, the NEDC marked a milestone, celebrating the 100th birth resulting from its embryo adoption program.
At the point where we reached 100 births, we had had enough experience under our belts to realize a couple of things. Certain we realized that this was a very viable idea that was serving an unmet need for both donors and recipients, and of course for the embryos themselves. We were starting to get a lot of positive feedback at that time, some press, people were very interested in this, and we realized, yes, this is a good thing. We've reached 100 births. There's no reason it should stop now. This is going to continue indefinitely.
Once we hit that 100 mark, then things seemed to snowball, and from that point forward, it's like more and more blessings were showered on us by both donating couples and then the recipient couples coming to us wishing to use this service. The word was out all over the United States.
It really has snowballed recently, and I think there are a number of reasons for that, but one of them is just that we've been blessed with very good success rates. Not only are good success rates though, but we have an awesome, wonderful staff. They treat all of our patients so well, and everyone just loves them, and we're really so fortunate to have a staff that's really dedicated and devoted to helping these patients and these embryos. So all of those things have allowed us to earn a good reputation, not only locally but nationally, and not only with the donating and adopting couples, but with referring physicians and clinics from around the country.
Over the past 10 years, the NEDC has moved into its own building, welcomed new members to the team, and expanded awareness of embryo adoption by reaching out to clinics, garnering media coverage of our family's amazing stories, and building a state-of-the-art website. All the while, the milestones have just kept coming. Hundreds more precious lives out of cryopreservation and into their parents' arms. In January 2019, Annalise Bailey made her entrance into the world. She is NEDC baby number 800.
She is our joy and our blessing, and very much the answer to a lot of prayers. And for me, she's the fulfillment of a heart's desire to be able to experience pregnancy and carry my child. And she is our daughter, she's a granddaughter, she's a niece, she's a cousin, she's a sister, and she means the world to our family. Our hope is that her story will inspire others to both choose to adopt embryos as well as to donate embryos. Ultimately, her story, I believe, is one of choices that many people have made for love and for life.
2 decades ago, the NEDC was just an idea. Now, with more births than any embryo adoption program in the world, God is blessing the NEDC with the impact its founders envisioned.
This has had a ripple effect above and beyond anything I could ever imagine. Saving these lives of these embryos as well as impacting other places across the country. God did something huge, and we got to be part of it.
I can't describe it. It's just, overjoying.
We're fortunate to get lots and lots of cards and letters, emails, tons of photographs, and that's really special. You see the love, the joy, the excitement that these couples have in realizing a lifelong dream. So many of these couples could not have done this in any other way, and this was literally their last alternative, their last option. So to be a part of that is just spectacular. It's a wonderful feeling, and I know I and the rest of the staff all share that feeling.
And none of it would be happening without your prayers, passion for life, volunteer work, and financial support.
It's almost like I can't even fathom. If the NEDC was not here, we wouldn't have the 2 children that we have.
So it just seemed like the perfect option for us and for our family at that point in time.
Giving life, giving hope, together. Thank you for being part of the NEDC family.